My name is Dr. Andres Fonseca. I'm a consultant psychiatrist. I'm also the CEO of Thrive, and I'm here today, this morning, with Elisa Marcris, who's one of our business psychologists. Elisa, do you want
Hi,
to
everyone.
quickly introduce yourself? Yeah.
Hi, everyone. Thank you for joining us today. As Andres said, I'm a business psychologist at Thrive, and I just graduated from my MSc in organizational psychiatry and psychology. Hopefully, these webinars that we've had in the coming days can really help you to cope with the events that are happening right now globally with the pandemic.
Yeah, that's our intention. So what we're going to do, this will run for around 45 minutes, I think, and there'll be around 15 minutes for questions in the end. There's a question and answer function that you can use, and Elisa will be screening those as we go along. And if there's any burning questions, she will put them to me, or she will answer them by text. She will also sort of, just make any comments and have her own questions. So you'll see her coming in every now and again. So what I wanted to talk about today is, if I can get my slides to work, actually, there we go, is health anxiety. And the reason I wanted to focus on this topic today is because, given the fact that we are hearing a lot about this pandemic, I thought that it's going to be in people's minds whether they have the condition and what the risks are, and they might result, as we'll see later, in triggering something, perhaps not health anxiety, but some of the symptoms of health anxiety people might start to experience. And I think it's important to understand this condition in order to perhaps prevent it. So I want to talk about what it is and how it happens, the typical symptoms and the characteristics that it has, and more importantly, how to deal with it, and perhaps focusing on how to how to stop it from ever actually happening. So that's kind of my plan, and I'll start by saying that it's actually one of the trickiest forms of anxiety. And the reason it's one of the trickiest forms of anxiety is because it uses the symptoms that anxiety produces to fuel the concern, the worry. Because we're worried about having some kind of a physical condition that triggers a response, which I'll go into more detail later, and that kind of fuels more worry. So the worry itself makes the worry worse, if that makes any sense, and it's particularly tricky in the case of health anxiety. So, for example, if imagine there's a case, when you notice yourself coughing, and you think it's a good idea to check with the doc, which definitely. So the doc checks and says, "No, you're fine. Don't worry. Actually, it's all fine. But if this keeps happening, or if you develop any new symptoms or anything changes, then come back to see me." And then instead of just being reassured, what happens is that, oh, why did she say those things? Why did the doc tell me that things, I could have more symptoms? Why? What other symptoms could there be? Should I be checking my body? Should I be sort of scanning thoroughly? Why did she tell me to come back? If she was sure that I was fine, then she would tell me. She would not need to tell me to come back. So then the rumination starts, and of course that produces more symptoms. Then you're scanning your body, and we're away we go. So that's kind of why it's particularly tricky. So one thing that I wanted to say is that there's no such thing as health anxiety. There's two diagnoses, and I'm not going to give you the technical terms because it's just not useful. But one of the two focuses on the presence of physical symptoms, and the individual is very preoccupied with his physical symptoms and focuses on them and on their presence. And the other one is more about being worried about having a particular condition and actually or contracting it or getting it from somebody. So it's both of those things. Both of them are characterized by experiencing a lot of distress, and the symptoms are so powerful that they disrupt the person's life. That's kind of the characteristic. So I'm talking about both of those conditions together, and I'm just going to refer to them as health anxiety. And these are the particular things that separate it from other forms of anxiety. So worrying about having or getting an illness is what I said before, having symptoms and then focusing on them, worrying about them, And very importantly, this last one, safety or avoidant behaviors. And those are things like going to your partner to seek reassurance. You know, am I okay? You know, do you think I'm okay? Checking your own symptoms. For example, checking your blood pressure, checking your breathing, checking your pulse, checking your temperature a million times. You know, making sure that your throat is clear, making sure that you're breathing easily, for example, and you're doing that body scanning that I'm talking about, checking everything. And then you might be going to the doctors, but you don't get reassured, or you get reassured temporarily, and then you have to go back and back. In some cases, people are just not going to the doctor, so they're avoiding the doctors altogether. And very, very commonly, Googling symptoms. You know, what are the symptoms? What should I be looking at? How does it present? If I have the symptoms, what is the condition that I have? And then using remedies in some cases, doing things that could be quite dangerous. We've seen, I think, recently some viral videos and also audio pieces on Facebook and other places telling people how to deal with COVID-19. Some of them, I mean, most of them are just wrong. The worst of them have a mixture of wrong things and things that are kind of right, but not how they say it. And the most dangerous ones are telling people to do things that are outright toxic, like, for example, using bleach. You know, there was one such thing circulating. So these kind of things, and not really trusting what the doctor is saying, but seeking out these old remedies can be part of it.
I think also one of the issues with safety behaviors at the moment is that we are all generally encouraged to do safety behaviors, such as washing our hands frequently and using sanitizers frequently. I think it's the fact that we're encouraged to do these behaviors which partly fuel this anxiety even more.
Yeah, absolutely. Yeah, I mean, that's the thing, and I've heard like ways of going about this hand washing, etc., that can be absolutely excessive. Yeah. So there's a reasonable number of times where you wash your hands, which is when for whatever reason, you've been outside, or you've been touching things, and you get back home, and that's when you wash your hands, and then you wash the surfaces, etc. But not doing it like every hour, like I've seen some people recommend. There is a balance to be struck there. So all anxiety has two things in common, really. One is this intolerance of uncertainty. Things have to be 100% certain, or otherwise something terrible is going to happen. And the intolerance to distress. So anytime anything becomes a little bit distressing, it's perceived that it's enormously threatening in itself. So it's this inability to go through anything that might be distressing in any way. So how is this fear of illness? How does it get started? What are the factors? So it can, you can be predisposed. It can be caused by your genes. There's other biological factors that can contribute, other exposures that you may have had throughout your life. It can be also partly driven by learned behavior. Maybe one of your parents was very anxious and was a bit of a germaphobe, and that can sort of leave an impression on you and make you more likely to develop it in the future. Or you may have had a person, the person themselves is what I mean by person. So if you yourself have gone through it, or a loved one has gone through it, that may trigger it. The death of a relative can trigger it for you. And if you've ever been in a case where you felt that a doctor missed something and something went wrong, and this could be perceived or it could be real, both of them. So those are kind of the predisposing factors. And then something...
I have a quick question. How does the pre-existing mental health conditions such as OCD also contribute to this? Because people with OCD have fears of contamination, and this health anxiety that is caused during the pandemic can make these fears of contamination so much worse for them.
Absolutely, yeah. But I mean, that is a little bit outside of the scope of what we're talking about today. But yeah, so there's a very clear relationship between I mean, OCD is an anxiety disorder, so there's an overlap in symptoms, and of course, you know, all of these things, as you point out, you know, the current situation can make OCD worse. So therefore, yes, you know, so if you have a pre-existing condition, so if you have, is my next slide, I suppose, if you already have something like generalized anxiety disorder or any other anxiety condition, then this current climate, this situation can all of a sudden trigger in you also a health anxiety. So that could be the scenario. The good thing about it is that the treatment plan does not change all that much, because all of these are anxiety disorders, and at the root of it, the strategies that we're going to use to address them are going to be similar. They do have some, you know, some subtle differences between them, but the core strategies are going to remain the same. So that's some good news there. So what are the triggers? So you may have a body sensation. So our bodies are producing sensations all the time, and for whatever reason, maybe because you're a little bit more apprehensive at this point in time, one of those body sensations triggers the anxiety. Or maybe you have a known health condition and you have a flare-up of that condition, even though it's well known. All of a sudden, the flare-up becomes very distressing and it triggers a health anxiety on top of having a real, an underlying physical health condition. Now, I've got social and other media highlighted there, and others talking about it highlighted there, because obviously this is the current climate, this is the current situation that we're in. So the media, social media in particular, may have a lot of misinformation and actually anxiety-inducing information, but also just the regular media will have this. And just listening others talking about it can lead to trigger an anxiety in us. Interestingly, what doctors say after consultations sometimes triggers it. So things like my earlier example about, you know, if things gets worse or if you have any other symptoms, please check back. You know, why did he say all the symptoms? What is he talking about? What is she asking me to scan for? And then off we go. Having a blood test. Sometimes you avoid having a blood test because you don't want to sort of know the results. But if you have one, that can trigger it. Or is even just waiting for the results of a blood test can trigger it. And once it's triggered, then you've got the components that we were talking about. Then you go down the avoidance route. You have those ruminations that we were thinking, you know, I have this condition. Yes, you know, the doctor doesn't know what they're talking about. I need a second opinion. I'm not sure. Let me check again. And then you do the safety behaviors to check, seeking constant reassurance, scanning the body, focusing on physical symptoms. As Alyssa was saying, some of the safety behaviors you might be induced to doing now would be washing your hands. Washing your hands might be the compulsion that you have. So you have all these, in a way, obsessional thoughts about being contaminated, having this condition, which are very distressing. And in order to reduce them, you're excessively doing things like washing your hands, or cleaning the house, or wiping surfaces, or doing all those kinds of things over and over and over and over again. So I just wanted to spend 2 quick minutes talking about the fight, freeze, and let me try again. Fight, flight, and freeze response, which is mediated by adrenaline. You've all heard of adrenaline. There are these things called the adrenal glands. They are on top of your kidneys. I didn't have a nice picture of a kidney, sorry. But I've got a nice picture of a heart and lungs, which is very relevant because a lot of the symptoms that are induced by flooding your body with adrenaline affect your chest and your heart in particular. So also your stomach as well. So you've got a list there of all of the things that this adrenaline can induce, all of these symptoms. They're all absolutely real, of course, and they're all caused just by the presence of that adrenaline. Now, interestingly, tightness in the chest is one of them. Having a feeling like you have a lump in the throat. And then coughing is rarer, but what happens there is that because you perceive there to be some kind of a lump in your throat, you want to clear it and you start coughing to clear it. And of course, that in itself is a worrying symptom. So again, is part of its own vicious circle. So you're focusing on the lump, trying to clear it, coughing, then you're coughing, then you feel more the lump, and that's what's going on. As you can see, all of those symptoms, unfortunately, they're also symptoms of health conditions in one way or another, depending on the degree. So that's what I was saying at the very beginning, that health anxiety is particularly tricky for this reason, because it kind of produces its own symptoms. So for example, the cycle will go something like this. You have this worry. I have COVID-19 because, I don't know, you had some kind of a trigger, like the ones that we've talked about before. So then that triggers the adrenal response to threat. So the adrenaline floods out of your adrenal glands on top of your kidneys. Then you produce all the symptoms that we've just seen in the previous slide. Then you start ruminating, which creates more symptoms, of course, because you're flooding your body with even more adrenaline because you're worried about more things, which, again, because you're focusing on them, now you're noticing them, now you're even more likely to worry and ruminate. And then that produces more symptoms, and so on it goes. So that's a difficult cycle to break. I wanted to introduce a quick concept that I think is very helpful to understand here. So there's two ways in which our brain operates, which our mind operates. There's this chap called Danny Kahneman. He's a Nobel Prize winner who described them with his colleague Alan Tversky, or Dr. Tversky and Dr. Kahneman describe these things. They're two psychologists. And so system one is the quick one. It's just your primitive, immediate reaction to things. It's very easy, it's effortless, it's almost invisible in the way it works. And it just triggers an emotional, let's call it an emotional, quick response. And the system two is your more deliberate, more thoughtful. You're going to actually reflect on things and think about them, think through them, and not necessarily act on the first impulse that pops in or that pops into your head. So there's always a bit of a battle between system one and two. When we're in a situation where adrenaline is pumping through our veins, system two tends not to have a chance at all to even speak, and system one tends to overwhelm it. So all the alarm bells are going off, and you have no chance to stop yourself and try and think rationally. It just overwhelms you, and it makes it very difficult. I think, Alyssa, you wanted to say some things about system one and two, just so people get a better idea.
Yeah. So system one, would you say that you would define it as the more emotional system, and system
Absolutely.
two as the cognitive, the more thoughtful system? Absolutely,
yeah, that's exactly what it is, yes. Yeah, so what happens is that system one is almost automatic. You don't have to, quote unquote, think about it, it just happens. And system two is where that requires you to concentrate, requires you to think, is more effortful. And yeah, so you have to actually almost willingly enroll it when you're in the middle of a crisis reaction, or you're in the middle of an adrenal reaction, when you're in the middle of one of those worrisome phases. Does that make sense?
So system two can help us control our anxiety.
Yes, exactly. So that's why I put them both here, because I'm going to talk about how we can strengthen our system two over the next few slides when I'm talking about the solutions. Yes, very much. So I just wanted to sort of give you a metaphor for that very quick. So if you imagine a system one kind of thing that exists in the real world, I'm going to call that a smoke detector. Okay, so you've got a smoke detector in your kitchen. Let's say that is a system one type system. Yeah, so the smoke detector, you burn toast. Nothing is, it's just it's a minor mishap. You burn some toast. There's some smoking coming out of your toaster. It's not going to be any fire or anything, but the smoke detector feels it and immediately thinks there's a fire. That's kind of like a system one response. So there's some smoke, therefore there's a fire. That's it. you know, alarm, alarm, fire, fire. A system 2 response would be, okay, let's check the smoke detector. Oh, okay, I see what's happened. There is a burning toast. No reason to be alarmed. That's more the system 2 type response. So I think that makes it clearer that the two roles. One just, you know, goes into an alarm mode, and the other one thinks about, is this really an emergency or not? Let's think about it. So one other point that I need to make is about learning, and that's why I go a little bit over the cycle again. So forces you, the cycle that we talked about forces you to repeat a series of thoughts and behaviors, you know, the safety behaviors and the rumination, the thoughts. I get this, you know, I'm going to get this illness. Why do I have this symptom? All of those things, you know, that happens over and over and over again, to the point that you do it absolutely without thinking. So you are reacting before you know that you're reacting. You are assuming things about the world and yourself, and you don't even realize that you're making that assumption. So because it's an automatic, you know, all the time, it becomes so automatic that you get hours, days, months of practice if you're not careful. So it goes like that. So you go the worrying and the symptoms, sorry, and then you go into the avoidance and safety behaviors, Google, reassurance, checking, all of that. So it becomes deeply ingrained and deeply learned. So that's the challenge.
Would you say that it's a subconscious thing that could happen to you without even realizing?
Yeah, so you might realize maybe at the beginning, so you may have a chance there where it may be a little bit more conscious. But over time, that's the problem, because you've learned it, you've repeated so many times, you've learned it so intrinsically that yes, it becomes subconscious. So again, so a good example might be, most of us learn to write at school, and if you can think back to those early years, actually it was very difficult to learn to write. It required a lot of effort at the very beginning, but now you do it without thinking. So this is kind of the same. So maybe at the beginning there was some awareness, but now you've done it so many times that it's absolutely automatic. You don't even realize that you're doing it. So how do we deal with this? We've got quite a few things against us. You know, we're predisposed, maybe not, and we got triggered somehow. I mean, again, I'm saying now because there are a lot of very powerful triggers about. And if we're not careful, then we've already done, without even noticing, lots of practice that kind of makes it automatic and embeds it. And we, as Alisa was saying, makes it absolutely subconscious. So we can now try and prevent it. If we are aware that this kind of phenomenon can happen, perhaps we can stop it from, you know, just by being conscious of it and never going down the route of practicing. Maybe we can prevent it from ever becoming a problem. But if we're there already, it's not a problem, because we can do quite a number of things that where we can rewire the system and you know, diffuse that that never-ending cycle. So cognitive behavioral therapy is the key skill to combat this. You don't need to have quote-unquote health anxiety. You may have just some symptoms, or it just might be a situation like we're in now where you're worrying about these things. It's a good time to practice these skills. So what it does, it considers the thoughts, that's the cognitive element. It also considers the behaviors that you're doing, for example, checking, going on Google, etc., going on the news, checking the number of cases, all of that. And it considers the physical reactions that those engender. So the heart racing, the chest tightness, maybe the lump in the throat, the coughing, all of those things. And of course, the emotions. The emotions are the context where your anxiety, your body reactions get interpreted. So I've got a model here for, this is the basic, it's called the hot cross bun. It's a basic model for cognitive behavioral therapy. This is embedded in a situation, which is represented here by the nice leaves. So the situation now is there is a pandemic, for example, that's the situation. And then we may have some emotions. We may be a little bit apprehensive at this point in time. Emotions are very hard to get at. So it's usually to intervene at almost any of the other points. So the behavior is easy to get hold of. Physical reactions, you can do something about them, and thoughts, there are techniques to deal with them. The emotions that the situation might trigger might be a little bit difficult, but you can get at them through the others, as you know, because that's what those arrows represent. So in this case, I'm a bit apprehensive and now have some kind of a strange sensation in my body. And then I get some thoughts, or that maybe I am developing, that maybe this is the early stages and I am going to sort of have the cough and the temperature and everything else. And now I'm going off to do some of those behaviors. So I'm going to sort of check check for my symptoms. What do they mean? Are these the early stages? Perhaps call my doctor and perhaps talk to everybody to ask for reassurance. Do I have it? Don't I have it? What do you think? So then, if we're not careful, then is when we go down that cycle. But this is kind of the model that explains what is happening to you. And it also gives you the point of intervention. So again, as I said, the emotions directly are hard to get at. So you can get at them through some physical health, so manipulating your physical body in some ways, changing your behavior, and also doing something about those thoughts. So,
related to this, sorry.
Go ahead.
There's an interesting question. How do I control my heart palpitations during my anxiety? It's worse when I'm lying down at night, also happens during the day.
Absolutely, yeah. That's a very, very good question. So the relaxation techniques, I was going to talk about them later, but I might as well talk about them now. So that's where relaxation techniques can help. So there's two ways of dealing with unpleasant body sensations. One is to endure them. So to sort of, so that distress tolerance that I was talking about. Yeah, so they are distressing, they are unpleasant, but they're not in themselves harmful. The ones that are triggered by anxiety, by this adrenaline. They're not harmful in themselves. So you can observe them, endure them, and just not necessarily react. Don't engage in any of the behaviors that they're asking you to engage in. So just observe them, endure them, and just sort of increase your tolerance to distress. That's one way. So leaning into it, do your worst kind of thing, leaning into them. That's one way. And the other way is to learn relaxation techniques that directly diffuse them. So for example, calm breathing, diaphragmatic breathing is a very well-known technique that is simple to learn, that will lower your heart rate. It triggers a reflex, it's a vasovagal reflex that reduces your heart rate directly by stimulating your diaphragm, and is by breathing deeply into your belly. That's very important. Not elevating your shoulders and doing that, but breathing into your belly so that you can stimulate that diaphragm, which is sitting just below your lungs. That's what you're stimulating with that kind of breathing. So in the app, we have that technique, and you can practice it even today to lower that heart rate. So
can they also use CBT in order to understand these feelings that they might be having, and what thoughts might have been behind those feelings of those heart palpitations and those bodily symptoms that they might be having? Maybe CBT would also work.
Yeah, no, absolutely. So this is the model speaks very much about that. So in this case, it would be, you've got this physical symptoms. So you've got a clue to the whole picture in that situation. So you've got the palpitations. So you're trying to sort of think, what behaviors is that triggering? What behaviors lead to it? Am I doing anything about it? What am I doing? Am I avoiding? Am I focusing on them? Am I body scanning? Is that making it worse? Is it keeping it going by me sort of worrying about it? What thoughts is it triggering? Can I note them down? And what is the emotional context? What is the mood that this is inducing? Is it worry? Is it apprehension? What's going on? And then what is the type of situation that tends to trigger all that? And that may help you create a model that improves the understanding of where those palpitations are really coming from, instead of assuming that they're coming from a particular heart condition, for example. So that is a way to start to understand that physical reaction. But to diffuse it, so those relaxation techniques, I haven't mentioned the others, but I'll mention them later, will also be helpful. Does that make sense, Elisa?
Yeah, thank you.
So I was saying that bodies are very noisy, so they produce a lot of sensations, and we can, as we've seen before, those can trigger the spiral, you know, the thoughts and everything else. But very importantly, so is the world. Today, or at this point in time, the world is extremely noisy and is bombarding us with information about this pandemic, and that is making it very easy to trigger these emotions and these physical reactions in us. So I wanted to focus on those unhelpful thoughts a little bit. For example, they can take these forms. Should I call the doctor? Should I check my pulse and my breathing again? Is what I feel difficulty breathing? You know, there's one of the symptoms that is bandied about. Do I have a temperature? Let me search all these symptoms on Wellbeing. Now, my challenge and the way that you can start addressing this is to try and externalizing these. So can you think of these as coming, these thoughts, these questions, as coming from the fear? So the fear is the thing that wants you to be stuck and trapped and not being able to sort of improve things with time. So the fear keeps you trapped by doing things like, well, basically lies to you. That's what it's doing. It's catastrophizing, telling you that there's the worst possible outcome is what's going to happen. It's going to distort things and make you see them in the worst possible light. And it's going to exaggerate things in the most unhelpful way to keep you trapped, to keep you in prison, quote unquote. It definitely wants you to stop living your life and just focus on your symptoms and your health. And it compels you to do all the things that we were talking about: scan, check, seek reassurance, go online, avoid certain things like avoid having a test, avoid going to the doctor, or avoid the distressing experience that you get by not going to the doctor. Consult another doctor. That's another common behavior that you might see. And it's got some rules, this fear that wants you to follow all the time. And if it gets you to follow them, basically it's trapped you. You're its prisoner. So one of the most important rules that it has is that you must be 100% certain. Never believe your dog. If it happened to somebody, it will definitely happen to me. If it sounds dangerous, it definitely is dangerous. You must always be vigilant and check and keep focusing on those symptoms to make sure they're not getting any worse. The worst possible outcome is the most likely outcome. Check again, make sure there's not worse. Search for all the answers. And when you get the worst result, that is the one. That is the one that basically applies to you. And the most important rule that it wants you to follow is you must do everything I tell you. So how do you deal with the fear? How do you tell it to go packing? So you need to, first of all, as Elisa was saying earlier, she was saying, can this become subconscious? And the truth is, yes. You cannot even realize that these are the things that the fear are saying. They just so these things, these kind of things. So they are so automatic that you don't even see them. So first step is to try and spot what the fear is telling you, and stop taking it at face value. So it's telling you things like you must always be vigilant, you must be 100% certain. Is that true? Is there anything at all in the world that is 100% certain? And you need to resist what it tells you to do. Those behaviors that it wants, so those safety and avoidant behaviors that we were talking about, you need to resist them. Of course, and accept that life is uncertain. There's nothing is 100% certain. So we all take calculated risks in everything that we do in life. Driving a car has some risks. Going out the door has some risks. Staying indoors has risks. Taking a shower has risks. Everything has some associated risks. And of course, all of these things are easier said than done. So I've got my little picture of a piano to remind me to tell you that little story about, basically, I can tell you all of these things. They sound very easy, but I could do the same thing about asking you to play the piano. I could tell you that the key, the secret to playing the piano is to strike the right key at the right time. And that's it. That's all you need to know, and it's true. So all you need to know to play the piano is strike the right key at the right time. but you cannot play the piano. So how do you actually get good at this? Get good at spotting what the fear is saying, stopping it, resisting it, and accepting that uncertainty. Well, you need the same thing that you need to get good at playing the piano. You need a lot of practice. The good news is that, to do these things that I'm going to talk about now is much easier than to learn to play the piano, much easier. You can learn these techniques and be quite proficient at them in about 4 to 6 weeks, and then you can practice them for longer and get even more expert at it. But 4 to 6 weeks is enough, and you will learn, you'll be competent, and they will be useful. So the CBT way, how do we deal with this anxious thought, the what if thoughts? What if I have this? What if this is cancer? What if this is a brain tumor? So, those kind of thoughts. So what is the evidence in favor? What is the evidence against? For example, the evidence in favor might be that you have a headache. The evidence against might be that your doc told you not to worry. And there's if you're honest with it, there's usually going to be a lot more evidence against than in favor. And then how much do I actually believe this? Believe this thought, the what if thought. Is maybe there's a small percentage, but I'm assuming is 100% real, or is 100% what's going on. You need to engage that system too, that deliberate system that we were talking about before, to actually rationalize it. And that is the CBT way. Strengthening system 2 is what you accomplish by using the CBT. And there's a mindful way as well, which is very much about managing your attention. So there is a thought, and the job here, after a lot of practice, and you start by practicing on focusing on your breath and things like that, but the exercise, what it's leading you to do is better control of your attention, to notice when your attention is being drawn to things that you don't necessarily want it to be drawn to, and to draw it back to anything else that you want. That's why you focus on the breath, because it's very boring. So when you're trying to focus on the breath, any random thought will capture your attention. Then you notice that your attention is being captured, and what you do is you disengage from the thought, and you engage with the breath, for example. And that is the training. That is like the repetition. That is the thing that strengthens that muscle. That is disengaging with the thing that you didn't even see coming, and engaging with the thing that you want to focus on. So you notice the thought, and then you discover that you don't need to engage with the thought. You don't need to answer that what if question. There's no need for you to sort of take it any further. So again, easier said than done. It requires practice, but it can be very effective. So how do we deal with the physical symptoms? This is the question that we had earlier. So they're real. The palpitations that this person was having are absolutely real. They are interpreted. They are interpreted through those emotions that I was talking about. So the same palpitations that you're getting there are the ones that you're going to get when you're going out for a race, or when you're very excited because, I don't know, because you had very good news. But the way you interpret them is very different. So in one particular situation, I'm very excited, I'm happy, and in the other situation, I'm somehow threatened, or there's something wrong going on. One important thing to know about them is that they can be endured. They're in themselves, they're not dangerous. They feel horrible, but they don't endanger you. So the characteristic of anxiety that we were talking before is low tolerance to distress. So this is what anxiety is doing, is making this discomfort intolerable, making it impossible to bear. And the only way to get out of it is to try and see if you can bear it, you can cope with it. And by doing that, by exposing yourself to that, it gets better and better progressively. And then the other thing that we were talking about, like I talked about the breathing technique, there's deep muscle relaxation, there's applied relaxation also in the app. All of those, the goal of them is to lower that adrenaline level, which then will lower the heart rate. So the purpose is to go through it and cope. You cannot really stop these things from happening. You can cope with them better. You can reduce how long they last. You can do things about them, but they won't stop, at least not at the beginning. The objective is to go through them. So when it rains, you cannot really stop the rain. What you do is to bring an umbrella so you can cope with it and still do what you need to do. So a common question that I get is, what is reasonable? So of course you're going to seek help if you need help. So it is reasonable to check with your doc if you have symptoms, definitely. But then you have to trust what the doc says. So your doc is never going to be able to give you 100%. As I said, this is the problem with anxiety, that you demand 100%, but it is not reasonable. However, your doc will have a plan. It doesn't have a plan because the doc is concerned. It's more that they need a plan just in case. It's always a just in case. So you need to follow the plan. Sometimes it's reasonable to get a second opinion. That's perfectly acceptable, but no more. So don't go for a third, fourth, fifth, sixth, because then you're creating a problem for yourself. When you get a test result, you need to trust it. And also when your doc gives you an interpretation of those results, you need to trust it. So unless you have new consistent symptoms, you need to very much not go to the doc all the time, but rely on regular checkups and normal. So those are the reasonable things to do in a situation like this. So just wanted to quickly recap what we've learned about how to deal with this kind of a situation. You may not have health anxiety, but you may be worried about things at the moment, and these are the things that you can use now to try and cope with it better. So it's when we're talking about the body, it's about enduring, not avoiding. You have to observe what your body is doing, and then you have to practice that thought detection that we were talking about. And then that is a very good opportunity to learn. So when you're getting those difficult, distressing sensations, that is a very good time to try and practice these skills, whichever ones you want to practice. The relaxation techniques, some of the CBT skills, or even the mindful skills. So when you're having the thoughts, again, we talked about how CBT deals with them, strengthening that system 2 function. And the other one is mindful attention control. So when you practice meditation sufficiently, then you have much better attention control. Then you can disengage in those worrying thoughts and engage in whatever else you think. You notice that you're being suckered into replying and entertaining these thoughts when you don't need to. And the behavior, what are the things that we do there? We need to sort of try and do the opposite of what the fear demands, and then see what happens. That's a kind of an experiment. Our anxiety will go up, we may get more symptoms, but why do we need to react? All the forms of exposure is, this I've used in cases in the clinic. And it seems to, I mean, it was daunting to many people when I suggest it, but it seems to be quite helpful. So you write your own horror story and then read it. So why writing your own horror story? Because a lot of the times is not articulated. Is not fully there. So what people have in their minds is a vague story, which is even more scary than the real thing. So it's kind of like when you have a thriller and there's a monster and you don't see the monster, you just see shadows. That's much more scary than when they actually show you the monster. So sometimes that exposure actually takes the sting out of the fear. And then you're deliberately going to read and watch things, you not avoid them. So that you get the exposure, so that you get the practice, so that you can practice your mindful skills or your CBT skills. That's another way to deal with it. So doing the opposite of what the fear is demanding. So the techniques that I've been talking about, the relaxation techniques, mindfulness, all of that are within the app, the CBT. There's a full CBT program that goes through the basics. It's a transdiagnostic. It means it's a program that teaches you the skills, and then you can apply them to any situation, really. So it's I think it's worth your while to learn and go through the whole course. Your employer will have a code. I don't know, Alyssa, is there anything that we can give them that is useful in order to get the code and know how to hold it?
You need to get in contact with your well-being team, your HR team, whoever has, they would probably have the access code ready for you to download the app so that you can practice all these mindfulness techniques that Andres was talking about throughout this webinar. I just also wanted to say from before, when you were talking about the behaviors in the previous slide, you were saying about writing down the horror story. Yesterday, we were also talking about having this designated worry time. And I think that might also help some people to assign some time within the day to have this time to worry about any anxiety-related issues that they might have, and then any sort of anxious thoughts or stressful thoughts pop into your head, to kind of have this resistance against them, and not have them pop into your head, and keep them for the time that you've designated to worry about them.
Yeah, so absolutely. So that's a way to not engage with them in the moment. Yeah, you say, no, I have my designated worry time. That's fine. I will worry about that when the time comes. So yeah, absolutely. That's a good tip. You know, so that designated worry time, no more than half an hour. Don't do it too close to bed, but it's a good time. You say, I'm not going to bother with this, but I will give it my full attention during this time. So that's another way to avoid engaging with automatic thoughts that pop into your head, definitely. So yeah, I don't know if there's any, I don't know how we're doing for time also. I don't know if
yeah, we have 10 minutes, but okay, we have a couple of questions. Yeah. So there's an interesting one here. I frequently feel the physical symptoms of anxiety, even when I'm not actively thinking of things that concern me. How can I manage this better?
Yeah, so I think it might be that is the, again, let me preface this by saying that it's impossible for me to comment on a specific case. So because I don't know you, so what I would normally require to try and answer that question well would be a consultation with the person to get to the bottom of what really is going on. Yeah. So let me just preface my answer by saying that. Now, having said that, in some cases, I don't know if this is the case in this particular person's case, but in some cases, or very many cases, what's going on is that the thoughts are so deeply ingrained that you don't even notice them. So if I go back to this one, where is it here? This first this first step, which is where I say spot what the fear is saying, is actually quite hard to do. And sometimes that is the first thing that we need to do, and it's actually difficult to identify what the thought is actually telling us. If there's a thought, some people say there's no thought. So it requires some practice and some work to actually bring it to consciousness and realize that it is there and what it's exactly saying, so that we can make it more real and then deal with it. So what I'll say is that I don't know in this specific case, obviously, but in very many cases, what happens is that those thoughts are absolutely invisible, and it's quite tricky to catch them. In other occasions, you know, maybe there isn't a thought, and maybe a much easier way into the whole thing is through the body sensations, through trying to regulate those. So if you come here, there's a point of intervention, which is the physical side, you know, the body. And by using the techniques that we were talking about, the calm breathing, deep muscle relaxation, applied relaxation, those techniques can help calm the body, which then calms the mind. So that is the other way of going about that particular problem, I think. Yeah.
Thank you. Here's another one with from Tammy. She's saying, I'm alone with a young child. What techniques can I stop her from panicking? She touches everything.
She touches everything.
Yeah.
Well, the child is touching everything.
I believe that's what she means. Yeah.
Okay. So there's a young child in the house touching everything. I mean, if your house is clean and you're washing your hands when you come back from outside, etc., there's no reason to worry about that. The children will be children, and they will do what they do. Is the child? I'm not sure I understand the question. Is the child the person that is worried, or is it the parent? Do we know?
The parent. What techniques can the parent use to stop from panicking her? So I guess what she means is, what techniques can the parent use so that she can also stop the child from feeling anxious? I guess.
Oh, yeah, that makes a lot of sense.
Yeah.
Okay, yeah. So again, not sure about the situation, but I was talking about, when I was talking about the things that predispose, I was saying that early experience. Yeah, can be a predisposing factor. So learned behavior. So what can you do so that you are not modeling a worrying, a health anxiety type behavior for your child? So again, I think is you need to sort of first start by trying those techniques for yourself, and so the fear is going to be telling you to do things and to stop your child from doing certain things. You need to sort of not give in to what the fear is saying. So it's like, can you endure it? Can you do so? You some anxiety is generated in you, but is it reasonable that you should behave that way? You have to go through a little bit of an analysis, that system 2 analysis. Is this proportionate? Is this reasonable? Is this true? If it is true, then you should act. Obviously, you should protect your child, and that's not going to cause any problem. But if it is, for whatever reason, exaggerated or inappropriate or excessive, then you need to sort of moderate that behavior. So can you stop and think? Can you spot that what the fear is telling you? Is it reasonable? Is it not? If it's not reasonable, if you decide after examination that is an overreaction, then you need to stop your own behavior so that you don't necessarily model it for the child, if that makes sense.
Yeah, thank you. Here's an interesting one about the horror stories. Julie has asked, could you model what a horror story being written about anxiety around COVID-19 would sound like, so that we kind of know what kind of thing we should be writing?
I mean, they're very personal.
Yeah.
I can come up with one that a patient of mine had. Is not COVID-19, but maybe I can talk about that one because it's one that we worked on with her. So she had headaches. As you saw before, headaches were a very frequent symptom that happens with anxiety. And she immediately, every time she got a headache, obviously it was going to be a tumor. So we worked on what that story would be. So you get a tumor. So then what happens exactly? So she was like, okay, so at one day, so she didn't want to get any checks done of any sort. So she was imagining that she would go and get a check done, an imaging, and then they discover something, and then it's inoperable, and then she was going to die, but it was not going to be just as simple as that, because she was going to be paralyzed down one side first, and it was going to sort of be horrible and very painful, and she would eventually die. Even though she was going to go through operations and all of this. So it was the whole story. And then we look at, okay, fine. So it is a horrible story, of course. How likely is it to happen? We were working on, okay, so if you have a headache, what percentage of cases would be then result in a tumor? What is the evidence for? If you were to get this diagnosis, how frequently it is that it's going to be inoperable, like you're talking about. How frequently is this going to happen? So bit by bit, we were able to sort of interrogate each one of the premises in her horror story and come to a more balanced view on it, so that it was not ruling her life as much. Yes, there is a chance that any of us can get a horrible health condition like that, but what is the likelihood of it happening now? What is reasonable to take? So by strengthening her system too, we were able to free her so that she was not basically being completely disabled by her horror story without even being able to live her life. So that's an example of how that may work, is just quickly described. Yeah.
Thank you. Here's another question about how to support somebody else who's close to you who's suffering from anxiety. So this is, do you have any advice for when your partner is the one suffering from the most with the anxiety, how to direct or signpost the person best when they're already at a point of overworrying or panicking?
Yeah, no, I think it might be one good step might be to share this this webinar with them if they are able to sort of look at it, and the techniques that we're talking about. You know, why don't they try some of the more simple techniques and see if that alleviates some of the anxiety. So yeah, so see if we can start by offering them some information that they might find useful for themselves, and then encourage them to seek help if necessary, or just try some of the techniques that we've been talking about today. I think for friends and family, in many cases the app is available. Is that right, Elisa?
Sorry, can you say that again?
Sorry, I think that in many cases the app is available for friends and family as well.
Yes,
So,
we
so
do
it can
have
be
the
shared.
app available for friends and family as well. So yeah.
So it can be shared. But I think, I mean, one good first step might be to share this webinars. A lot of the time, people don't even recognize that they have health anxiety as a thing. They don't realize that this is a thing, because the symptoms are so physical that it's quite hard to even sort of think about it that way. So sometimes just a little bit of awareness is enough to start the process. So, you know, very happy for anybody to share the webinar with the information with anybody who they think might benefit from listening to this kind of presentation that explains it in detail and explains a little bit about what to do about it. Yeah, that might be a very good first step.
We only have around 1 minute left, unfortunately, but we have quite a few questions that we regretfully couldn't answer yet.
All right, well, I think we'll leave it here then. Thank you all very much for your interest and for your participation. It was great. And as I said multiple times, we will make this recording available to everyone. And do share it with anybody who you think might be a little bit anxious and who might need a little bit of persuasion to seek extra help or to start trying some of these techniques. You know, as I said, in some cases, you know, you cannot really deal with health anxiety if it's severe enough. You do need to consult with somebody. Some of these self-management techniques are not going to be enough. So do seek help where necessary. But in other cases, just, you know, being exposed to the information might enable the person to recognize that this is going on and might start them on a path to try and do some of these techniques for themselves, or seek further help. Yes.
Thank you very much.
Thank you all.